My name is Leighton Chan. I'm a physician and I'm the chief of the Rehab Medicine Department at the NIH Clinical Center.
My name's Ann Scher. I'm an associate professor of epidemiology at the Uniformed Services University.
I'm Michael Roy and I'm an internist. I do adult primary care. Well, I really started looking at first the impact of depression, post-traumatic stress, anxiety disorders in the primary care setting. And then after Desert Storm, where in the early 90s, we had a lot of soldiers with Gulf War syndrome, this kind of mystery illness. So I started doing some work in that area, looking at what could be causing these kinds of symptoms. I began looking at that and identifying that really due to the fact that when we send somebody off to war and they're in a situation where they can't let their guard down for months at a time. They have to be hypervigilant, sleeping with one eye open and so forth. That really has some lasting effects in a lot of people.
I initially became interested in headache disorders because of close acquaintances of mine who were affected by severe chronic headaches. I could see firsthand just how disabling and what the great impact that chronic headache can have on somebody their entire life.
The brain is a fascinating thing. Certainly the most complex organ in our body, and our understanding of it is in reality somewhat limited, but we're on the cusp, I think, of discovering many new things about how the brain functions, how the brain heals itself, how it responds to injury. And so what we hope to do is to gather information from both civilian traumatic brain injury as well as military traumatic brain injury and help sort out what we call the natural history of the disease, and perhaps bring into better focus what actually causes a mild, moderate, and indeed a severe brain injury.
The current study that I'm working on, the soldiers are interviewed immediately after deployment because that appears to be a time when headache problems are most bothersome. And then we contact them a few times over the telephone to follow up to see how they're doing in terms of their headache, their work status and their family status.
Well, there's one study we've been doing for more than 3 years now where we're comparing what's really the best treatment for post-traumatic stress or PTSD right now, which is called imaginal exposure, which asks the individual to picture that they're back, say for one of our soldiers where they're in Iraq and say a IED blew up their vehicle, to picture they're back in the vehicle, the bomb goes off, and asking them, close your eyes, picture that, and describe it to me, first person, present tense, like it's happening now. What we're comparing that with is virtual reality exposure. So we put them in a virtual Iraq or a virtual Afghanistan. So this is a computer-generated environment, but it looks pretty real. So we're comparing those two forms of treatment head-to-head to see which one works better.
We value everyone's participation in our studies. We're very grateful when people are willing to participate. And it's important scientifically that we get as many people to participate as possible because it makes our results scientifically more valid.
I think it's important for people to take part in research because it really helps us to prove whether one type of treatment is better than another.
Frankly, without volunteers, clinical research can't occur. And without clinical research, we wouldn't really have advancements that we've seen in cancer. We wouldn't have the advances we've seen in infectious disease. We wouldn't have advances we've seen in neurologic disease. So it's actually a critical piece to advancing our knowledge about how to take care of one another.